My first topic I'm going to do is talk about virtual reality training and spend 10 minutes doing that, and then I'm going to talk a little bit about nerve sparing and histological confirmation afterwards with robotic prostatectomy. So there's two Da Vinci robotic simulators that are commercially available right now, the ROS and the Mimic system. And these are standalone simulators independent of the surgical robot themselves. And both have a fairly comprehensive software program to train for motor cognitive skills, and also have metrics that you can use to assess performance. There are face and content validity studies done for both of these. This is for the ROS system, again showing good technique, good results, that there's content and face validity for the ROS. Same thing for the Mimic system. This was done earlier, Mimic came out earlier. And we acquired a Mimic trainer about 2 years ago at Columbia, and now there's a second generation Mimic system with the new software that's the same software that's used on the actual Da Vinci SI surgical simulation model. But we have it on the Mimic trainer, and so we did a study with the second generation Mimic virtual reality trainer. And again, the whole concept here is that it should simulate the Da Vinci system at the console. This is a cost-effective offline way to do this. You don't need operating room time, you don't need instruments, you don't need setup. And it should it should replicate the kinematics and the needle targeting, camera, clutch, dissection skills that you would need to do robotic surgery. You get an M-score evaluation. For anyone who's actually tried this at one of the conferences or any of the meetings, there's different metrics you can look at: time to completion, economy of motion, and there's a passing score, and you can set it to what you want so that you can make it stringent, less stringent, and create a curriculum that you want say your hospital wants potential robotically trained surgeons to do, or residents to do, or medical students to do, based on what you think is an appropriate criteria. So this was validated, showed that 80% of people thought that this was reasonably similar to the Da Vinci console. This was useful for residents. All residents who used it thought it was useful. So this is what's been done. We did a randomized control trial using the Mimic versus the Da Vinci dry lab training to assess skills assessment. And what we've done is, the whole goal here is that we want to look at concurrent training. So these are residents in the urology program who are doing clinical robotic stuff depending on their level of involvement, but need to be assessed on basic robotic skills. And there is no gold standard way to train. There's no system in place. We developed a curriculum on the Mimic just by playing with the different modules and saying, okay, this is a good 3 hours that somebody should spend and get these skills, but is it really what you need to do? Nobody knows. So what we did was we took the urology residents and we did a baseline evaluation on anyone with Da Vinci. So we did a needle pass suturing skill and this ring, this moving this rubber band around the ring that Intuitive has developed to teach camera, clutch, all of the economies of motion that you need. And then finally I did a OSAT score, so I evaluated everyone as they did it. So everyone got this baseline evaluation. So you can see the randomization scheme here. There's the group one, the Mimic group. Everyone did a baseline eval. Everyone did a secondary eval. Group 1 had a Mimic virtual reality training in between. Group 2 did a dry lab Da Vinci training. And Group 3 did nothing. This is the control group. So Group 1, the Mimic training group, did 15 exercises on the trainer based on what we thought may have been a fairly comprehensive but doable and achievable program. And again, endo wrist manipulation, camera clutching, needle control. There is no knot tying exercise. And I want to make a point of that because we did assess this. This is a little video of one of the cautery and cut. We did not assess this because we don't have an equivalent dry lab model to do cautery and cut. This one is a needle targeting drill that we did assess, and you can see you got to put the needle in the right target, move it, transfer hands, and continue to follow where it wants you to put the needle in. Same thing here. It tells you where to go, and you have to throw the needles. So the needle throwing and targeting skills are there, but the actual knot tying is not part of this. And then finally, the camera clutch skills where you have to move these different numbers and boxes, and it forces you to continuously clutch, move the camera, and actually use the fourth arm to hold some of these open while you use two hands. This is actually a high-level skill in the grand scheme of things, which I think is a very good exercise. Same thing, basic, simple ring pass, put it on the peg, you have to clutch over, you have to use the camera. Group 2 did one-on-one training sessions with one of our endourology fellows serving as the mentor, and they did the same skills, including knot tying. So they did the ring pass, as you can see here, which does teach camera, clutch, movement, economy of motion, and I don't have a video of it, but it's pretty straightforward, the throwing the needle and tying knot skill. And this was 3 hours, roughly, spent in both arms in the training. Group 3 was a control. They did the baseline evaluation, they did the final evaluation, but they didn't do any specific training in between outside of their normal curriculum in the clinical training program. So we had 16 residents randomized, and we looked at experience. You know, we called it robotic experience. We had novice would be less than 50 clinical cases assisted or in the room, and intermediate as more, and there was even distribution amongst the groups. PGY training levels, there was a relatively even distribution among the groups, no difference in those three groups. Baseline evaluation, group 1, group 2, group 3. For the first exercise, ring and wire, no difference among the groups. For the robot suturing, no difference among the groups. And for the OSAT score, no difference. So this just shows that all three groups started at the same place. Results for exercise 1. The mimic group showed a statistical improvement in time. Da Vinci group showed a statistical improvement in time. The control group did not show an improvement between the baseline and the secondary evaluation. Exercise 2, mimic group did not show an improvement because there was no knot tying skill as part of the curriculum. So clear, good example of a specific skill that's not incorporated into that curriculum that did not translate here. The Da Vinci group did show a statistical improvement in time because they did do that skill as part of their training. And the control group also did not show an improvement for lack of training. The OSAT scores, the two groups, Mimic and Da Vinci, both showed an improvement in their scores, and the control group did not. So, curriculum-based training with Mimic Trainer, Da Vinci, can improve robotic surgery skills when you compare it to no training, which is actually a point that hasn't been made yet, so training helps. Whether you train on a virtual reality platform or whether you do a dry lab training, outside of the specific suturing knot tying skill, there's no difference. So you can actually replicate dry lab training with virtual reality. And there's no difference in improvement between the Da Vinci and the Mimic group when you compare them against each other. The deficiencies, well, right now, it's knot tying, as we talked about, and it's the cautery dissection. There's no procedure-specific steps. This is coming close to using bipolar energy to coagulate vessels, but it's not really good enough to replicate, real-life surgery. So we didn't really study this, and this is where the deficiencies and the attention has to be placed in future modules. Thank you. I just want to thank Dr. Koretz, who's one of our very motivated residents that helped put this all together.